Amol Soin has devoted his career to really helping patients with all kinds of conditions, with things like not using unnecessary surgeries, helping them get rid of their pain, and he's doing it with some revolutionary devices.
Love coming to Eurasian. I've come here for many, many years. We brought Mercedes, Lexus, and BMW here. Eurasian's done a fantastic job. They don't send it out somewhere else. It all gets handled right here. They treat you like family. I've always been pleased with the service here.
Trust Eurasian.
This segment is sponsored by Soin Neuroscience, Inc.
Dr. Amol Soin has devoted his career to really helping patients with all kinds of conditions, with things like not using unnecessary surgeries, helping them get rid of their pain, and he's doing it with some revolutionary devices. He's joining us this morning to tell us a little bit more. Good morning, doctor. Good to see you.
Good morning. Thank you so much for having me.
Of course. So let's talk a little bit about something that is very prevalent, especially in women right now. It's urinary incontinence. A lot of women suffer for it. You have a revolutionary device that's going to help them treat it. Tell us a little bit about the device and how you're really, truly helping success stories with some of these patients.
Yeah, sure. Urinary incontinence is a huge problem. I recently heard a statistic that they actually sell more adult diapers than diapers for babies. And it just shows you how prevalent that is. Something like 40 million Americans will suffer it at some point in their life, particularly females as they age. We've actually developed a device that can interface with the nerves that cause urinary incontinence, and it sends an electrical impulse or signal to that nerve to make it so that the patients do not have the incontinence symptoms. It can actually prevent the urine from leaking out into their clothes and stuff, and allow for a more regular experience by targeting the nerve that's involved with causing the incontinence.
That's huge because it's something that can affect women throughout their whole day. I mean, you're talking about things that maybe they're embarrassed about. This is really going to change the way that they go about their daily activities. I mean, their life has got to change after something like this.
Oh, certainly. I mean, even just being able to plan your day and do things you want to do. And of course, the social embarrassment that comes with this kind of stuff is all very challenging. So it'd be nice to have a device that can actually control and help that.
Yeah, good news. And then we're talking about something else that is very prevalent, pain. There's a lot of people out there who are suffering with pain and have been for many, many years. Now, you have another device that's going to help block these nerves that you were talking about a while ago. Tell us a little bit about how you've gotten people off of pain medication and how they're living free of back pain or knee pain, whatever it is that they're dealing with.
Yeah, so our pain management devices have been excellent, and we have developed what's called neuromodulation, which is a system also known as spinal cord stimulation that can actually stimulate the spinal cord to prevent the nerve from firing a pain signal, or at least to block it from firing a signal. And this has been tremendous. It has changed people's lives. We've seen in our clinical trials pain scores dropping to a 0 or 1 or 2 out of 10, where they say 10 is the worst possible pain. We have videos of people who've tried our device and said that they've never felt this good before, and it's just been tremendous. And the way we are going about doing it is a way that hasn't been done currently. In other words, our technique of spinal cord stimulation is completely novel and distinct compared to other devices that are on the market. And this is very exciting. And we've actually compared our device with several of the other ones and have noticed a pretty significant improvement.
That's great. And a lot of this sounds like very high technology. It sounds like maybe out of reach, but it really isn't. Is someone like me or someone that we know that has just everyday insurance, is this something that we can use and we can get access to?
Oh, certainly. In fact, there are actual insurance billing codes and a whole process to get these types of devices for you. So if you have insurance coverage, even in my state of Ohio, for example, Medicaid covers these types of things, as does Medicare, and almost all the private payers do as well. So it's not out of reach for people to get it. And there are established ways to get it covered by your insurance, which is tremendously exciting because it opens up access for everybody.
Absolutely. That's good to hear. So let me give everyone the website where they can find more information. If you are suffering from urinary incontinence, if you're suffering from chronic pain, you can do something about it. All you got to do for more info is visit soinneuroscience.com.